I'm Dr. Kelly Burkenstock, owner of Skin Body Health Clinics in both Mandeville, Louisiana and New Orleans, Louisiana. We also practice in Alabama and Florida, where we do live demonstrations and we do as well as live clinics there. Across the nation, we do Zoom and teleconferences, so we're able to help people with such things as menopause conditions, male menopause or andropause conditions, hormones, anti-aging, weight loss, all kind of different obesity trends that we can help you find your optimal weight. Of course, we would have to be in person to do Botox or lasers, but most of the things that we do, we can actually help you with, whether you're here locally with us in Louisiana or in one of our shows in Alabama or Florida, or if you're anywhere across the nation. So please like and share our videos. We've been on YouTube for quite some time now, a few years, and what our mission is to help people understand and grow their knowledge with longevity and vitality with all the new things that we have. Like, did you know, for example, there are 7 different herbs and supplements that can reverse, not just stop, but actually reverse some of the cholesterol plaque in your arteries. And yes, there are international studies. That's not our venue for tonight, but those are just some of the things that we talk about. Tonight, what we're here to talk about are leg veins. So there are bulging leg veins, which can be very powerful and very painful and very bulging, so that they look like ropes or worms sticking out of the legs. Now, those are a true varicose veins, although a lot of people just call any sort of spider vein a varicose vein. So superficial leg veins can cause red, blue, or purple discolorations, especially when they resemble a spider web type of pattern. They can be found on the feet, the ankles, the lower legs, or even the upper legs. Tonight, we will identify those for you, and we will also show you a live demonstration of how to make those absolutely go away. It is the time of year. Here we are in spring, and when we want to get ready for summer, you need 2 to 3 months to get those legs ready and in shape to bear those beautiful legs. If you have a little bit of spider veins, sometimes called telangiectasias, other times called varicose veins. While they're most frequently seen, as we said, the thighs, the calves, or the ankles, they can appear anywhere in the body. Sometimes we're actually treating some bad veins that might appear in the face, although that's a little bit more rare, and occasionally on the chest. They can start appearing in your 20s, and they are more visible as you age. Although there are some severe forms, which we will touch on, but that's not what we're treating today. Those could be a symptom of vein disease like peripheral venovascular disease and such. That's rare. Most of the ones that are seen in the legs, although they look nasty, they're harmless and they're not representative of any significant disease. Most treatments are done for cosmetic reasons. However, if you're seeing veins that are broken or spiderwebby on the legs, those veins aren't useful to you. They're no longer working. They're actually pooling a little bit of blood, and so they're getting caught and they look nasty, almost like water draining down your driveway. It just goes through the path of least resistance, and it's not necessarily a gutter or something productive to getting rainwater or other types of water off of the roof or the property. So when we shut down those cosmetic veins or veins that are just irritating us cosmetic-wise, people often ask me, well, am I hurting my circulation? And the answer is, no, it may be hot, but it is not affecting your circulation. So they can sometimes feel hot, very hot. But when we shut those down, all it really does is improve the circulation, because those are really dead-end strips. They're dead ends, so they're not producing any productive circulation. They're stuck, And when you shut them down with sclerotherapy and laser, and I'll be demonstrating for you laser in a little bit as well. So after, you always first do sclerotherapy, and we use a product called Sclerodex and polydecanol. Then you come back with the laser light after, and always after. The reason why you come down after is because the laser is only good for tiny, tiny little matting. Matting that is so tiny that the tiniest of needles available, in this case a 33 gauge needle, which is very tiny. Imagine that a B12 shot might be a size 21 or 25, and the smaller or the higher the number, the smaller the gauge of the needle. So if a B12 was a 21 or a 25, for example, then veins out of 33 is a very, very, very tiny, tiny needle. So we're going into those. We do everything that we can do with the hands. That is the very best approach. Always you want to do it with glasses, because even if you can see perfectly well, whether it's readers or we also have some magnifiers, you want to be able to see with a good light the tiniest of the vessels, and they will come to the top best when you've got actually a super magnification. So what are some things that can aggravate these veins in the legs? Hormones. Hormones is one of them. So we will see them come out, and once they come out, they don't go away. We can see them with increased age, so that our hormones are changing. We're approaching menopause or even perimenopause. Also with pregnancy. They can get damaged with substantial standing or substantial sitting. Either way, we're putting pressure on those legs and those leg veins. Unlike the arteries, which have natural pumps to get the blood back up and circulate, veins don't have that. Veins get the blood back up to and from the heart with movement. So if you're standing in one spot like a school teacher, a doctor, a nurse, or a chef, for example, or if you're sitting a lot like an accountant or computer analyst that's constantly sitting, either way you're putting extensive pressure on those veins, and without that movement the valves can't push the blood back up. You get some breakage of the smaller ones, and that's when we see these unsightly veins. Oh, I forgot to mention pharmacists. So lots of my pharmacist friends come on in to get vein treatments and wear compression stockings when they're working behind that counter. So there's a lot of different professions that endure excessive standing or excessive sitting. So as I said, also with hormonal changes, because they dilate the veins, and you could have had a past injury to the area. So say you fell off a bicycle, I had a bad motor vehicle accident, and had a severe jar into the legs. Well, where that happened, we can also see some residual telangiectasias or cosmetic veins. Vein conditions are very common. It can be up to 50 to 55% of women and 40 or so percentage of men have these spider veins. And over half the population have some broken veins after the age of 50. So how do you get rid of them? Well, if you have symptoms or concerns, please go see a physician and we can analyze them. If we see that they're the deeper kind or suspect the deeper kind, then we're going to get an ultrasound done of these venous contributories and determine if it's a deep saphenous or deep large vein problem, or if it's a superficial tiny vein problem. If they're deep, then different treatments are recommended than if they're shallow. So if you haven't spoken with us before or listened to some of our audio and visual, we have a website, Dr. Burkenstock Skin Body Health. It's also our YouTube channel, Dr. Burkenstock, that's B-U-R-K-E-N-S-T-O-C-K, Dr. Burkenstock Skin Body Health. We do have a product section there, and so what are the things you can do to support your veins? Number one, exercise, movement. Number two, compression stockings with at least 15 millimeters of mercury. If you have a bad condition, 30 to 40 millimeters of mercury. That is a prescription strength compression pantyhose or stocking. What can you do in terms of foods? Your citrus foods. Why? Because vitamin C supports veins. Also collagen. So some bone broth and other foods that can have collagen associated with them. What supplements could possibly help? Well, we do have a spider vein defense bundle. All of our products in Dr. Burkenstock's Skin Body Health product line are GMP seal of approval, which means they are made in FDA approved facility. So the two products I would recommend for spider vein defense, in other words, to prevent these guys from happening or to help them from getting worse if they're already there, would be our C Power 2000, which is buffered vitamin C in a powdered form, and also our Collagen Supreme, which is also in a powdered form. So a scoop of each, and you can put it into a fruit juice or water or tea, stir it up, swallow it down, and all that vitamin C and collagen is going to give your veins that added support, as well as your bones, your hair, your skin. So many things that vitamin C and collagen are good for. However, Spider Vein Defense Bundle normally retails for $150 on our website. It's enough for almost 3 months. And right now, if you would like to go in for our special, they will be on sale for $119 for both products in the Spider Vein Defense Bundle, $150 marked down to $119, and that will be going on for 2 months. So just go to the Spider Vein Defense Bundle, grab your special, try it, and see if you don't see an improvement in your veins. I know that you will. So, besides eating our citrus fruits and our collagen-based foods and supporting it with vitamin C powder and Collagen Supreme powders, what else can we do? Well, please remember that movement, remember that exercise, and to eat well. Those small things can make so many changes and differences, all for the good. Avoid crossing your legs. So crossing your legs at the knees and or the ankle can promote these spider vein breakdown. Try to sit with your legs either tilted or straight up and down, because when we cross them at any venue, we're putting extensive pressure. A lot of times we do this when we're reading or studying something or intently watching TV or the news, either out of habit or a feeling of comfort, but the comfort leads to later discomfort because we're breaking down the veins. So routine exercise, it can be walking, it can be running, it increases leg circulation as well as a swimming pool exercises, so water aerobics. They help maintain a constant flow of blood through the valves in your veins. Again, avoid prolonged sitting, crossing the legs, or even long-term standing, because that allows for blood to pool up in your legs, and most of which is held in the veins. Take a break, walk around the counter, walk around the building, walk up and down a flight of stairs can make all the difference in decreasing the venous or vein pressure in your legs, which prevents valve damage. Prop your feet up. Prop your feet up when you're watching TV, or sleep with a couple of pillows under your knees and legs. This elevation of the legs, putting your legs above the heart, it uses gravity to pull the blood from the lower extremities up into the core body and into the heart. Compression stockings can be wonderful. I don't like the ones that go to the knee, because then you're getting almost a rubber band action there. Some of my colleagues feel it's better than nothing. I guess we could look at it either way, but I see more breakage when we come to the upper calf from that extensive banding around the below the knee. You can get thigh highs, but I think by and large, although they may be, a bit unsightly under clothes or uncomfortable, more than unsightly because you really wouldn't see them, is a pantyhose, because the pantyhose goes all the way up to the waist. It comes in female and male versions. It comes in 15 to 20 millimeters of mercury, so a lighter compression that will still help, and then a 30 to 40 millimeters of mercury, which certainly helps, especially if you've got a more moderate or more severe case. So these are some of the natural things we can do along with vitamin C and collagen. So what can we do to treat these guys? We can do sclerotherapy. Now, old-fashioned, they used glycerin or salt water called saline. Those burn a lot, and they injure the veins, in my opinion, more than absolutely shut them down. So you're getting a temporizing result or more that come back in the neighborhood. So I like Sclerodex or polydecanol. There's a couple other foaming agents that I like, and they go in, they're relatively painless. You can return to your activities that day. You don't have to go home and rest or anything. I wouldn't recommend harsh aerobic pounding on the veins for about 3 days. And if you can wear the compression stockings for 2 days, 3 days, or even up to a week if you're gung-ho, it will help those veins to be able to shut down, stay down, and get out of the way. So once they die off, then your good veins get a little bit more of an improved flow. Not dramatic, but certainly we're improving flow, we're not decreasing flow, we're not hurting or injuring anything. If you can see those nasty veins, they're not working for you anymore, they're broken, so let's get rid of them. So we do the sclerotherapy, and then for the little bitty tiny matting ones that even the tiniest of needles can't go into, then I come back with the laser. So we use a BBL, broadband light laser, and we do it at a 560-15-15 level. We don't press harshly because that can blow the vein. We press lightly, and we have a tremendous result with getting through those veins. Now, if we've determined that you've got a deeper problem after we've looked at ultrasound, we would then offer you transcutaneous laser ablation. Well, that's a big word. And we actually don't do that procedure here. We've been trained in it, but I just feel like some things are left better in the specialist's hands. We would send you off to a specialist. So they would put the teeniest of entryway into the skin, send in a little laser probe, and go deep to where that vein is, nearer to the bone. So it's more like a small river. Shut down that river. Once the river's closed down, then we come back and I can do all the cosmetic work. But if I do the cosmetic work and there's a deeper river down below that's broken, it's just going to make more broken mess superficially. That's why we take the time to analyze our clients, diagnose our clients, and make sure that we've got just a superficial problem. Because if we've got a deeper one, the deeper needs to be treated first with transcutaneous, which means through the skin, laser ablation, and or vein stripping, which is a little bit more old-fashioned procedure, but is still done where they actually strip the vein after making a small incision. So, as I've said, they're very, very common, and you don't have to live with them. You can get beautiful legs back again, and it's a very, very easy and simple treatment. So, without further ado, our cameras will shift a little bit, but please forgive us. They're going to come up close with at least one of the cameras, and we'll show you what it looks like when we can absolutely shut down a laser vein like that. So you will see, first you will see the vein, you will see me to enter the vein. Sometimes it does take 2 or 3 attempts. We're going to shoot it down, and then that vein's going to be gone. It's almost like Hollywood magic. So we've already prepared. I'm going to come over to this blue one here. And you can see the blanching where the vein's just disappearing away. Gone. So you'll see that they could be red or purple or blue. All of them that you see are in fact broken veins, regardless of the color. So that blood in the cap of the needle there is telling me that I'm inside of that deeper blood vessel. We've killed it. And over the course of the next 2 weeks, this entire patch will be clear. And like magic, they're gone. The nice thing about leg veins is once they're gone, they usually, or in most cases, never come back in the same area. Now, just like a garden that grows new weeds, you may see something in the future in a different area, but the ones that are shut down remain shut down. So this whole patch just got killed. Okay, so I thank you so much, as always, for tuning in. If we can help you with your veins or any other problem, please feel free to let us know. So you would like to go to someone that's very well-versed in veins. Maybe they're in the American Academy of Vein. Also, if you're going to get an ablation, make sure it's someone that is either a cardiovascular surgeon or does cardiovascular or any kind of other vascular. You wouldn't want to put it in the hands of someone that's not very well trained when you're fooling with transcutaneous laser ablation. I thank you for tuning in. Help yourself. Eat citrus fruits. Eat bone broth. A lot of things with collagen and vitamin C. Don't forget about our bundle, and if we can help you in any way, I'm Dr. Kelly Burkenstock. Please share and like our video. If we can touch the hearts of your friends, families, and other clients, that's what we're here on a mission to do. You take care. Thank you.